Hi, sixth graders. So this is our last lesson from our Too Good for Drugs program, lesson 8. And in this lesson, we are going to talk about the safe use of prescription and over-the-counter medicines and street drugs. We are also going to talk about risks, healthy and unhealthy risks. So in our last lesson, we talked about the drug marijuana. So how does marijuana use affect the brain? So the THC in marijuana blocks the messages in the brain affecting your depth perception, reaction time, and short-term memory. So how could marijuana use affect a person's ability to reach their goals? So marijuana use causes a lack of motivation, so users stop caring about whether or not they reach their goals. Considering what we've learned about tobacco, alcohol, and marijuana, it's surprising that anyone would risk trying drugs. So who can tell me what it means to take a risk? Okay, so you might say to do something that involves the possibility of injury, damage, or harm. So risk-taking involves doing something that carries the possibilities of a negative outcome. Risk-taking is a normal part of being a teenager. The challenge is to know the difference between a healthy risk and an unhealthy risk. So we make decisions that involve some elements of risk every day, and the elements of uncertainty and danger that come from risk-taking can be thrilling. Let me ask you a few questions. So how can risk-taking be healthy? So it can be healthy because you can learn new skills, you can experience new things that help prepare you for future challenges. So healthy risk-taking pushes you to try new things you might otherwise be too afraid to. How can risk-taking be dangerous? Well, you could put yourself in or others in harmful situations that lead to unwanted or negative consequences. So taking an unhealthy risk could be harmful, could be dangerous, and can get you into trouble. So why would someone be willing to take unhealthy risks? Well, they might not stop and think first. They might want to fit in. They are influenced by something, maybe peer pressure, TV, or family, or friends. They want to try something new and different. They might want to break the rules. So risk-taking, like making decisions, can result in a positive or negative outcome depending on the circumstances. Okay, so I have a formula to help you with the risk-taking. A healthy risk, okay, the formula for a healthy risk is that it is safe, legal, supports your goal achievements, and helps you learn something new. So an example of that would be, trying out a new instrument, maybe auditioning for a school play. Okay. Unhealthy risks are unsafe, they're illegal, it will hinder your goal achievement. Okay. So you might not achieve your goals, and may cause unwanted or negative consequences. Okay, so an example of an unhealthy risk would be trying something like marijuana, alcohol, or a nicotine product or tobacco product. So next, let's discuss these two scenarios and determine if these scenarios are healthy or unhealthy risks. So scenario number 1 reads as this. Shayla noticed signs posted around school for the upcoming talent show. She wanted to perform a modern dance routine in the show, but she was afraid that she wouldn't make the cut. She worried that if she auditioned and was selected, she would feel both, or wasn't selected, she would feel both rejection and embarrassment. So is auditioning for the talent show a healthy risk or an unhealthy risk? Okay, if you said healthy, you are right. Okay, so what makes auditioning for the talent show a healthy risk? Well, auditioning for the talent show is healthy because it is safe and legal. It supports Shayla's goal achievements, and the talent show will give her a new experience. Okay, so definitely a healthy risk to take. Every risk has a outcome, right? It could be a negative or it can be a positive outcome. So what's a possible negative outcome of this risk? So yeah, she might feel embarrassed if she doesn't make the cut. Okay, the embarrassment isn't the greatest feeling. What about the possible negative outcome, or does this possible negative outcome, though, outweigh the potential benefits of performing in a talent show? So sometimes you have to ask yourself that. Okay, so Shayla's friends and family encouraged her to audition. Because of this encouragement, she considered her options and decided to go for it. Shayla performed a flawless routine for the judges, and she landed the opening spot in the talent show. After auditions, Shayla reflected on her decision to take a healthy risk and try out. She felt self-confident and happy because she stepped out of her comfort zone, and the risk paid off. She could hardly wait for the talent show. So what if Shayla had not made the talent show? Should she try it again next year? Yes, risk-taking is a part of life, okay? These healthy risks are a part of life, and you have to challenge yourself to take healthy risks in order to learn new things, and so you don't miss out on great opportunities. All right, so let's figure out the next scenario. Let's figure out what type of risk Dylan is facing. So scenario number 2 reads, Dylan just started at this school and is eager to make friends. He met Chris and Jared in band class. Chris and Jared know a lot about music, and Dylan's passion is playing the trumpet. One day at lunch, Chris and Jared said they were going to hang out after school to smoke marijuana with some older teens that Dylan didn't know. They claimed it was a harmless way to get high because everybody does it. They pressured Dylan to join them. All right, so what type of risk is smoking marijuana? If you said unhealthy, great job. Okay, so think about our formula for an unhealthy risk. Okay, so smoking marijuana is harmful, right, to someone's health or to your health. It is illegal, right? The harmful effects and negative consequences from smoking marijuana can prevent Dylan from reaching his goals. Okay, so before agreeing to join his new friends, Dylan stopped to think about what they wanted him to do. He considered his options and the positive and negative consequences of taking the risk to smoke marijuana. He knew he would get in serious trouble at home with his parents if his parents found out that he tried marijuana. Dylan also knew the harmful effects of smoking marijuana and didn't want anything to interfere with his passion for playing the trumpet and his goal to hit every note perfectly in the upcoming music recital. After making his decision, Dylan sat up, looked Chris and Jared in the eye, and told them he was not interested in smoking marijuana. Confident with his decision, he picked up his trumpet and left the cafeteria to continue practicing for the recital. So with these two scenarios, we determined healthy and an unhealthy risk. Now, for you, the next time you consider taking a risk, I want you to remember the formulas. Is it safe? Is it legal? Is it going to help you with reaching your goal? Or is it going to help you with reaching or learning something new? Or not? Is the risk going to leave you safe and happy with more confidence? Or will taking this risk be unsafe or harmful and you get into trouble? So I'm going to read you some statements and I want you to calculate the risk I would like you to tell me if they are healthy or unhealthy. Okay, so I'm going to read through. I want you to think to yourself, and then I will determine, okay, the answer. Okay, so texting while riding a bike, healthy or unhealthy? Definitely unhealthy risk. Trying out for a school club or a sports team, healthy risk. Riding in a car without wearing a seatbelt, unhealthy. Sneaking out to meet new friends, unhealthy. Skipping school, unhealthy. Auditioning for the school play, healthy risk. Drinking alcohol, unhealthy risk. Asking someone to dance, healthy. Taking a friend's prescription medication, unhealthy, and we'll talk about this later on in the slideshow. Signing up for your school's talent show or displaying your artwork at your school's art show, definitely both healthy risks to take. You have the skills now to differentiate between healthy and unhealthy risks. So we're going to apply these skills to the risk associated with misusing prescription and over-the-counter medicines. So prescription, so a drug or a medicine that is prescribed by your doctor, and over-the-counter medicines, so medicines you can get at a pharmacy or a drugstore, can be very helpful when used as directed, right? When you are sick, they make you better. However, taking prescription drugs in a way that hasn't been directed by a doctor is very dangerous, very harmful, and could be fatal. Also, over-the-counter medicines, if they are not taken in the correct usage according to the labels, or if taken when you're not sick, can have very harmful side effects and effects on your body. So for example, prescription medicines, when they are abused, can lead to difficulty breathing, confusion, difficulty sleeping, and a decreased heart rate, drowsiness, slowed brain functioning, nausea, vomiting, sweating, slowed breathing, and slurred speech. Prescription pain relievers, when abused and not taken correctly, can lead to constipation, decreased heart rate, drowsiness, itchy skin, poor coordination, slowed breathing, and unconsciousness. And over-the-counter cough medicine, when abused and not taken correctly or when it should be taken, blurred vision, confusion, dizziness, increased heart rate, slurred speech, stomach pain, and vomiting can occur. So the misuse of prescription and over-the-counter drugs, as we discussed, is a very unhealthy risk. Okay, so now we're going to talk about another risk, the risk of using other drugs such as inhalants and street drugs. So what is an inhalant? So an inhalant is a chemical or substance inhaled to produce a high. What is a street drug? So street drugs are made illegally and sold on the streets. Street drugs include cocaine, heroin, and methamphetamines. Okay, so some of the effects of using and abusing these drugs, and with our unhealthy risks, they lead to unhealthy effects. So some negative side effects of inhalants would be getting headaches, feeling dizzy, loss of appetite, a rash around your mouth and nose, slurred speech, muscle weakness, loss of balance and coordination. Inhalants and inhaling can kill brain cells and damage your body tissue and organs. Okay, the street drug cocaine is a very highly addictive drug that negatively affects the brain. Someone that uses cocaine will experience insomnia, which is you can't sleep, high levels of energy and possible chest pains, violent behavior, loss of appetite, vomiting, excessive sweating, and blurred vision. Okay, methamphetamines, another street drug, which is highly addictive and very toxic. You might have heard it being called meth or crystal. The effects are hallucinations, loss of appetite, sweating, rotten teeth, picking at skin, sores on the skin, confusion, dry mouth. Okay, and the street drug heroin, which is also highly addictive and deadly, slows down your heart rate and breathing, and it causes poor judgment. You will see alertness followed by drowsiness, suppression of pain, decreased respiratory rate, clouded mental functioning, and vomiting. So as you can see, these drugs can cause serious negative health effects and can lead to many negative consequences and even death. Someone who tries these drugs did not stop to calculate the risks before using. So we want you to choose healthy risks that are safe and that will lead to positive things in your lives and positive consequences. Okay, so congratulations, sixth graders. You've completed our Too Good for Drugs program through SCAZA. And so throughout this program, you've learned and practiced skills that you will continue to use throughout your life so that you can be happy and healthy. We hope that you use these skills every day and remember the dangers of drug use so that you can continue to make good decisions and to reach your goals. Great job, everyone.